At-home COVID testing is the next frontier in the battle to curb the coronavirus. Just last month, the FDA authorized a self-testing kit that provides results on the spot. But many are still choosing to lean on traditional means of testing. In tonight's Rebound Detroit, 7 Action News reporter Amira David explores if these at-home testing kits are a good fit for you.
Today, I'm doing something most Metro Detroiters have never done before. I'm taking an at-home COVID test, a self-collection kit that only about 8% of those I surveyed on Twitter said they had once used to figure out if they've been infected by COVID-19. But let's rewind for just a moment. Because before sitting down to take this test, I sat down with the experts to find out how this all really works.
People might be scared to insert it in their nose.
Dr. Charlene Brown is an advisor to Everlywell, the first company to get authorization from the FDA for an at-home test. She says the big draw for this kit, and for others like it, is that they don't require a swab to go as far up the nose as what's typically seen in a healthcare setting. This lower nasal swab is way less intrusive and easier to do on your own.
It's a short swab, and you just insert it 2 to 4 centimeters in the front of your nose.
But the appeal goes well beyond comfort.
You can do it at your convenience, and you're not limited by when, a place is open, and, you're not really kind of rushing in and exposing yourself to people who may have the infection.
Dr. Prasanthi Govindarjan is a part of a team of Stanford researchers that developed Vera, a cloud-based FDA-authorized at-home test. This after conducting an eye-opening study that determined self-swabbing tests for COVID-19 were just as accurate as those done by medical providers, and perhaps even safer.
It minimizes exposure of healthcare workers to people who may be infected.
But how user-friendly are they? I wanted to know, so I followed the detailed instructions step by step. Collecting the sample did feel a little strange.
So it definitely makes your eyes water a little bit, but all around not too bad. Now I need to put it into the actual collection tube.
Overall, a pretty seamless process. Pack it into another sealed tight box, followed by a prepaid delivery slip. And the only thing left to do was send it off.
All right, let's see how long it takes.
With frequent phone updates, I was told the sample arrived to the company within 24 hours and to an FDA-authorized lab shortly after. My results were in hand within 3 business days.
Are there any things consumers should be looking for before selecting one of the COVID-19 tests on the market?
Yes, you want to make sure that the test has been authorized by the FDA.
There are more than 25 FDA-authorized home tests available. But here's the Rebound rundown on the cost. Prices for an at-home kit range from $100 to $150. As for insurance, we checked with Cigna, Blue Cross, and HAP. They'll cover the cost in full as long as the test is deemed medically appropriate by a healthcare provider.
Now, you'll be asked to pay up front and get reimbursed, or just have your insurance company bill directly. Either way, this is a great alternative that could save you tons of time and potentially even save a life. For the Rebound Detroit, I'm Amira David, 7 Action News.